And as far as you said, you lost weight, and you mentioned you're pre-diabetic. Have you had a chance to look at blood glucose again since you've started, or any thoughts on that?
I did my as my part of my physical. I did my fasting blood glucose and all that kind of thing, and everything was normal.
Okay, so the pre-diabetic number is now back in the normal range.
Yeah.
That's got to be good. Did you ever notice? And it may have been maybe you didn't, maybe you just couldn't figure this out. But did you ever have like flares of your stroke symptoms? Like some days you'd be like, "Wow, I'm really dragging harder than other days," or "I'm more cognitively impaired." Did you ever notice like any patterns, or like maybe you could say, "When I eat this, I get, things get worse." Did you ever notice that prior?
So I never consciously noticed anything like that. Like I would always put something like that in the past down to I'm just tired.
Mm-hmm.
Or well, when I was drinking alcohol, it was always worse. Yeah, I don't about foods. I'm not sure. Because I would always put it down to just tiredness.
Yeah. Well, that's fair. I mean, and maybe the food is making you tired. Who knows? It's hard to say. And it's both. As far as the alcohol goes, I mean, some people, I don't know that, I mean, people associate Japan with some people drinking, and they have, the sakis and things like that. But if you look at it, they don't drink that much. I mean, really, I just saw literally a comparison of all the countries. And I think Latvia might have been, or Lithuania, one of the two was the biggest in the world where they're drinking. Japan wasn't that high. But what did you find that, like, whatever was compelling you to drink, has the compulsion gone away? Do you find less desire to drink now?
I don't find any desire to drink at all. So Japan has an easy access to drinking culture. So one of the problems with drinking before was it's acceptable to kind of drink on a train here in Japan. Right. So I'd be coming home from work late at night and, to relax after a stressful day, you'd get the beer from the convenience store and you just, drink the beer on the train on the way home, that kind of thing. And it just kind of escalates from there. That was probably the hardest habit to break. But now I don't feel anything. And I feel like part of the reason I don't feel like compulsion anymore is because when you're on the carnivore diet, you have this more of a feeling of self-control.
Yeah, that's true. I think a lot. That's fair to say. Let me ask you. You've been obviously you like speaking. You've got a nice studio set up, so you're set up to get this message out there. And like I said, somebody, I can't remember who brought you to my attention, but I watched a couple of your videos and I said, "Oh, this is really interesting to see." Are you getting any negative pushback? Usually, people are saying, "Hey, I'm out here healing disease." Now, I'm out there, putting studies up that vegans don't like and sometimes making fun of. So I get a lot of negativity there. But are you getting negative pushback saying, "Hey, Dave, you are eating a bad diet. You're going to die of cancer, heart disease. You're destroying the planet." Is any of that coming your way or no?
Yeah, there's quite a bit. YouTube catches a lot of the comments that are really bad. I received actually a comment overnight that was something like, yeah, you'll see when your LDL is through the roof and that causes atherosclerosis, you'll be dead before you know it, that kind of thing. Mm. So you get people commenting stuff like that, but I don't feel that. I think I've watched enough from people like I can't remember his name. This is an Australian doctor. I've watched enough stuff about LDL and when LDL can be negative for you and when it isn't and stuff like that. That I'm comfortable.
You might be talking about Paul Mason. I'm guessing probably Paul does.
Yes, that's right, Paul Mason.
Yeah. It's interesting. Like I said, you're a guy out here just sharing a recovery story, which is wonderful. And then you have people sort of go after you. Now, I think it's important to point out that the type of stroke you had was a bleeding stroke and not an atherosclerotic clot type stroke, which is a lot of people associate atherosclerotic disease when we see strokes with that. So there's different types. And interestingly, the literature supports that vegan diets actually increase the risk of the type of stroke you had, the hemorrhagic type strokes. And so it is, kind of interesting now that you're on an animal-based diet, and maybe, who knows? Your diet back when you were a kid, 17-year-olds, probably typical junk food kid diet, I'm assuming, or what were you eating back then? Do you remember?
Oh yeah, junk foods. Yeah, definitely.
Yeah. Interesting. It's kind of, if you could go back, 30 years and tell 35 years and tell your 12-year-old self, which you probably would never listen. I mean, I wouldn't listen to myself. I can imagine. I'm like, what would you tell yourself? And I'm like, I'm not sure how to listen to me, because you're just kind of stubborn at that age. But, you could have avoided the stroke and all that stuff. And it would have probably, changed the course of your life, I would imagine, to some degree. Have you had any other like post-stroke people now contact you with any of this? Have you heard anybody else so far?
I don't think so. No. Sorry, I have. On my channel, when I put out one of the videos, the reason I put out the video that you mentioned in one of your videos about post-stroke recovery was because after I briefly mentioned having the stroke in one of my initial videos, it was flooded with comments of people saying, my wife had a stroke 2 years ago and being on the carnivore diet has improved everything for her, that kind of thing, And I wish I had I've got to actually tally this up, but if I go into my YouTube and I just put stroke as a filter in the comments, like there are so many comments come up now.
Yeah, it'd be interesting to see. And like I said, the reason I think I made a post because there's a guy he just got elected senator in Pennsylvania. His name is John Fetterman. And the big controversy is because he had just had a stroke while he was running, and it felt like it was seriously impairing his ability to speak and function correctly. And so people are saying, well, can this guy even do his duties? And one thing I said, well, and it's interesting, he follows me on Twitter for some reason, which I thought was kind of cool and interesting. I said, well, I kind of said, hey, there's possibility that Carnivore Diet might potentially help with strokes. You might want to look into. I haven't heard back from them probably, but I don't know that I ever will. But I just think that's kind of a really interesting thing that, I've seen so many conditions that carnivore has helped that I never would have thought. I remember first time Tourette's syndrome. I saw Ehlers-Danlos syndrome. This is a genetic connective tissue disorder. All these things, like I said, when you said I've had a stroke and it's been 30 years ago, and now you're seeing, what appears to be benefits of the stroke symptoms is really quite remarkable to me. And so it's good for you for bringing that up and sharing that. What are your? Obviously you said your day job is to teach English. What are your goals with, are you just trying to get the message out there, or do you have any goals with social media channels? Are you trying to reach other stroke people or just people in general about carnivore?
Yeah, I mean, honestly, with my channel, I'm just hoping to kind of spread the word, because I feel like we've had the wool pulled over our eyes for our entire lives, and we've been told, eat bread, eat whole grains, eat pasta, eat this, that, the other, have a balanced diet, and you'll be fine. And we're sicker than ever. And I just like to try and get the word out there. And if I can get, one or two more people to give it a try, then it's worth it.